Welcome back to Life's Beat, where Dr. John Šarfenberg, our guest today and expert, is talking to us about hypertension, high blood pressure, dietary aspects, and some other important parts related to the control of high blood pressure. Just briefly, if you could tell us, what is your feeling about the role of nuts in the diet as well as the vegetables and fruits related to high blood pressure?
Of course, this has a lot to do with the potassium, too. Right. And you got the right type of fatty acids, like the right type of oils. And
that helps those arteries to respond just quite a lot better than they would normally. Is that correct?
Yes.
Good. And of course, I think it's quite important to mention, and our viewers need to know, that the African folk have a significantly greater problem with high blood pressure because they have a blood pressure which is salt sensitive more than in other race groups, and that has important aspects to treatment. Would you like to talk a little bit about salt?
Yes. See, the difference over there than here is that most of our salt now is in the packaged foods.
Right.
It's already in the food.
Right.
Whereas over there, it may be more separate.
Right.
They add it so they can take it out easier.
Right.
We can take it out today. So right now, there's a big push in this country to get the food industry to join with us in helping in this program and lowering the salt intake that they put in the packaged products.
So a lot of processed foods have a very high sodium content.
Right.
If a food is preserved, if it's a pickle or if it's a preserve of any kind, one needs to look carefully and make sure that you're not taking excessive sodium, particularly those people who have a very sensitive blood pressure to high salt. And I think that's a warning we need to all of us take to heart, but especially people who are at that particular risk.
Now, yesterday, I talked with Dr. Michael Jacobson. He's a PhD microbiologist who's in charge of the Center of Science in the Public Interest.
Right.
And he has written a letter and got many scientists to sign it to our government to ask them to take salt off the generally recognized as safe list, put it as a food additive, and put it under the Food and Drug Administration to make the industry pay attention to what we're saying about lowering the amount of salt in the processed foods.
So this is a very important step that is being taken, and
it is.
Hopefully it'll make some impact.
Yes.
And we look at a lot of the snack foods, the crisps and the peanuts and the pretzels, all have a high content of salt.
Right. If it's not sugar, it's salt.
And I had an interesting experience with a colleague physician who said to me, he was just joking around and said, just be careful of all that airline food because of all the salt. So any food that is pre-prepared and over-processed, beware of the salt.
Right.
Tell me, we've talked a lot about diet, we've talked about water, we've talked about vegetables and fruits. Are there other risk factors for high blood pressure? What about the weeds? Smoking?
Smoking really increases the risk tremendously. And so smokers need to do something right away. They need to get off that cigarettes.
Absolutely.
Now, a lot of people say, I've tried, but I couldn't make it. You know, people have tried 6, 8 times, but they finally made it.
Right.
So if you tried once and failed, try again.
Right.
You need to do it till you get off.
So that's a very important aspect. And the other aspect would be related to nutrition this time. What about weight?
See, smokers eat more poorly than non-smokers.
Okay.
See, and the serum carotenoids decrease in the amount of the cigarettes smoked. So we know there's a dietary factor with these smokers also.
And what does that do? How does that affect the health?
That increases the cancer risk.
Right.
So it's important that these smokers eat right, even if they're still smoking. They should eat right.
All right. So now we're watching the diet. We're watching the salt intake. We're taking adequate, fresh, clear water.
We got to exercise.
Exercise. What about exercise? How good is that?
You know, the people who walk 2 miles a day compared to less than 1 cut their risk of dying from all causes combined by 50%.
Wow.
And including the hypertension risk and the heart attack risk.
So this whole thing of exercise added to everything else we're talking about is a very, very important I would say, even cornerstone in prevention. Exercise prevents cardiac issues. It also decreases the risk of high blood pressure, but it also is a treatment aspect for high blood pressure.
Right.
It's important, though, I think, that our viewers know that they must be on adequate treatment before they get into the exercise program. Don't go exercising when your blood pressure is crucially high, because that could be a major problem. So remember, we're also talking that medications, and you mentioned that earlier in the program today, medications, are they important?
Yes, they're important. They'll improve a lot of situations. You know, if you have to take them, you need them. The doctor puts you on them, you better stick to it. A lot of people start them a little while, the blood pressure comes down, and then they stop.
Well, there have been some very big trials which have been very important in our understanding of blood pressure. And people who have what we call moderate high blood pressure, and I'm going to ask you some numbers in a moment, but they've been shown that they sometimes need up to 3 medications for resistant blood pressure. So we need to remember that there's the non-drug therapy, which is lifestyle, nutrition, cutting the salt, doing the exercise, losing the weight, stopping the smoking, and we're going to talk a little bit about alcohol as well. But then also there's the aspect of taking medication where it's needed. Now, tell me a little bit about alcohol.
Well, alcohol increases systolic blood pressure. But besides that...
What is systolic blood pressure?
Well, that's the blood pressure where the heart is beating.
Okay, so
diastolic is between the beats, and systolic is when it's beating.
So that's the force of contraction of the heart,
right,
pushing up the top reading.
But alcohol decreases the effectiveness of the medication the doctor has prescribed.
Okay.
So we need to get off the alcohol. Now, you've heard all this about it's so good to reduce the risk of heart attacks. Look, alcohol is the wrong answer.
Well, it's associated with increased blood pressure. In certain instances, we know that alcohol can be associated with strokes as well, increasing the amount of strokes.
Increase of cancers.
Right. So you've answered that question for me very adequately. What would you say is a blood pressure where one needs to be careful and say, we've really got to bring in interventions here? 120/80 or 130/90? What would you...
Yeah. Well, of course, everybody realizes that if you get to 95 diastolic, that is certainly bad.
Right.
160 systolic, that is certainly bad.
Right.
You've got to do something to get that down.
Tell me about community approaches to high blood pressure.
Well, the new approach, you see, if they just take the people with very high blood pressure and just treat them, they'll help a little. But if they take everybody and lower all their risk factors, they'll help a lot more people. And the risk, the rates will drop tremendously. So the community approach is making our ideal stricter on every aspect.
Right. So
instead of exercising 30 minutes a day, it's now 1 hour.
Wow.
See, it's different. Right. Instead of a blood sugar of 126 or 140 being the diagnosis for diabetes, it's 126.
Now, is the World Health Organization interested in this kind of approach?
They are doing this. This is what they're promoting also. So it's kind of exciting what they're saying. Blood pressure, we used to say 120/80. Now they say get it down to 115/75. LDL cholesterol, we used to say 130 is okay. Now they're saying 100.
So what we're hearing today is that we have to look at our nutrition. We have to look at lifestyle. We have to look. It's not just popping the pill. It is changing the lifestyle. It is cutting the weight. It is stopping the smoking. It is cutting and stopping the alcohol. And it is living a much better lifestyle so that we can have that quality of life and avoid the silent killer of hypertension. We look forward to seeing you again at Life Speed.